Before we start, there's a little exercise that we're going to do. Is it okay if I use English? Yes. I'm speaking in English somehow. I'm weird. That's why. I'm going to talk about JKN, obviously, in this era of Sustainable Development Goals from 2015 until 2030, which is covered in the target 3.8 goal, health and well-being, universal health coverage, in relation with primary healthcare principle. I forgot to scroll, sorry. Why did I choose this ones? It's because the identity of JKN is fundamentally wrong. And I'm going to tell you why later. And this is just a preliminary perspective because SDG itself is only implemented since 2015, so it's only been going on less than a year. As well as JKN has only been since 2014, January, so it's been less than 2 years. So not a lot of literature on those two. However, there is a lot of literature about primary health care principles, so I mainly will talk about those two. And I'm going to specify a little bit about my methodology here. I'm not going to be as sophisticated as the other speaker, obviously, because I'm just a lowly master student. I'm not a PhD. So I'm going to talk about a lot of literature that has arisen on these topics. And then for JKN, I'm going to talk about my experiential account as working as a GP or a general practitioner, Dr. Umu, under the system of BPJS. Okay, first things first. I want you to all, except for the ones doing their thing, to close your eyes for a little bit. Close it, yeah. Focus on your body. Focus on your lungs. I want you to take a deep breath, as deep a breath as you can, until you feel that your lungs has expanded beyond measure. Hold it. Release. How does it feel?
Good.
Really good. Yeah. Breathing is one of the best and most basic fundamental function in our body, but we take it for granted just because we can. We breathe automatically. Try not breathing for 4 minutes. You're gonna pass out. But
1 minute.
What we fail to realize is that every time I click my fingers, another child died of TB. It's not here. It's not in this room. You don't know anybody who's died of TB. They're dying in Africa. They're dying in remote parts of Maluku. They're dying in remote parts of Bali. But you don't know that, because you don't know them. Even though this issue has been arising like so many times over and over again, you are intellectually aware of this problem, but you're not emotionally attached to it. How can I pretend that I don't know what's going on when every second and every minute another soul is gone? Everybody in this room knows about that song, but nobody actually understands what it means. Nobody actually puts a finger to help somebody who's dying in agony, not being able to breathe because of TB. And this is the identity that is fundamentally wrong in JKN. Okay, as I said, what is the difference between this professor over here in academia and a group of lovely ladies over there? Does anybody know? The similarity, sorry. Yeah. They're human. Fantastic. Okay, the answer is they're mean to each other. Very mean. Like, for example, you're not going to see it now, but when you're in conference, international conference, they tear each other apart, asking difficult questions. Sometimes they're not going to be able to answer because it's not their field. Like the lovely ladies over there. Like, you know, this lady, I don't have a pointer, so I'm just with my finger, old-fashioned style. She's a bit on the plus side. She's like me, it's a bit chubby. They are all smiling and holding hands, but behind, they might say, like, she's so fat. I don't want to be friends with her anymore, but I have to, because we work together. And I'm like, oh. They're mean to each other. So what I'm trying to say is that we have to stop this culture of being mean to each other. If you have a question to me and I can't answer it, don't humiliate me or any other presenter that's standing in front of you. And we have to start right now in this student roundtable. Okay, I'm going to play you a little bit of video, transitioning from Millennium Development Goals. For those of you who doesn't know, Millennium Development Goals is 8 goals implemented in 2000 until 2015, and 3 of them are health related. And since 2016, it has been scrapped, implemented by a new sustainability development goal. Now, my professor told me, apologies for the technical issues, I'm just going to ramble here for a little bit. So my professor told me that MDG, Millennium Development Goals, was essentially conceived or created by 3 white guys, rich white guys in a basement. So they did not look at the conditions in Algeria, they did not look at what Nigeria needs, they did not care about what Indonesia wants to do in their country. They think that water and sanitation is important, HIV and malaria is important. That's why they make these 8 specific goals based on what they know the world actually needs, or what they think the world actually needs. While Sustainable Development Goals is a lot more comprehensive than that. They invite all 190 countries to collaborate together, state, my country need this, my country need that, and they create 17 different goals with 169 different targets or indicators that is specific to each country, but also globally has a common denominator. And that's why SDG is sustainable, while Millennium Development Goals is a little bit donor-driven, as we can say. Okay, so I'm not going to be able to show you this, but you can check it out. There's a lot of videos on YouTube explaining why MDGs has been successful and failing at the same time. Okay, what lessons have you learned? As I told you, it's largely donor-driven, but conceived by 3 white guys in the basement. And then they do not realize that health, vaccines for HIV, maternal health, and child health, these are inseparable from other developments. How can you improve the health of a mother when gender equality is still happening, gender inequality is still happening? How can you improve the health of children when nutrition is still under ideal circumstances? So, if you have bad economy in your country, if you have bad education, you're not going to be able to achieve this health. And that's why developing and developed countries fundamentally differs in terms of achieving the goals in MDG. Developed countries like Canada, USA, Donald Trump, Australia, and even South Africa has already have good infrastructure in place. That's why it's easy for them to come up with the targets for this MDG. While Iran, Egypt, Indonesia, they barely scrape up half of it because they do not have the necessary infrastructure, they do not have the economy, education, or the equality in place necessary to achieve those goals. And then the identity that I want to talk to you about is that JKN is fundamentally concerned with primary care instead of primary health care. So what is the difference? What's the difference? Come on. I've already given you the clues. That's right there. Yeah, there's no health in primary care. Primary care, Puskesmas, GP, Faskas, is mainly concerned with sickness, curing sickness, individual sickness, while primary health care is focusing on health. Whose health? Society. I don't care if you're healthy or not, as long as the society in general is healthy. They're going to look at statistics, they're going to look at community development in general, instead of whether or not you are healthy after being surgically removing your cancer, for example. That's why the definition of health that WHO conceived in 1948 has been deemed outdated. Look at the definition. Health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. But we are living at the era of non-communicable diseases. I think I'm healthy, but if I want to be honest to myself, I have a disease. I'm overweight. So I'm not completely free of this, but I am healthy. According to society's standard, I do not have any kind of infirmity or disease that is fundamentally fatal to my healthiness. So this needs to be changed into just a state of physical, mental, and well-being different for each individual. For example, if you have cancer, your definition of health is not because you have cancer and you're unhealthy. Cancer people have good days and bad days. They have remission and recurrence. When they are in remission, they consider themselves healthy, but they do have cancer. So that's the difference. And now what are PHC, primary healthcare principles, that I have been talking about over and over again? The first one is equity, and I'm going to talk about this more in the later slides. It generally means access for all. And then empowerment or participation. If a stakeholder, for example, those 3 white guys in the basement, told that this program is fundamentally beautiful, I love this program. Now implement that program in Al Jazeera, for example, where the community, the cultural values actively reject the implementation of this program. They are not engaged, they are not participating, and they are not empowered by this program. Is this program going to succeed? No. So community participation is integral. If you want to change a community's health, you have to include that community's health in the program. You're men, women, disabled, then you're going to get the same wage for the same amount of skill. However, look at the outcome. This guy, who has A equal amount of opportunity, he can watch the game comfortably. He can watch a little bit unfavorably, but this one can only look through the fringes. Not everybody has benefits with equality. But with equity, look at this guy. He's tall enough. He has enough privilege that he doesn't need any additional opportunity. So don't give this guy any. Transfer the opportunity to somebody who is in need of this opportunity. That's equity. And that is not happening in JKN nowadays. This is the reality of JKN. If you're living in Kalimantan, for example, where there is lots of crocodiles and snakes but no healthcare, nobody's going to care about you. Because JKN only funds FASCAs. They do not fund programs that improve health. They only care about curing sickness. But if you are the CEO of a very good company and you have lots of money to spend, you can have like 5 different healthcare insurance, including JKN. And you can fly all over the world just to cure a sniffle. That's the reality. That's what we have to change. Now, this is just a crash course on SDGs. If you want more, check out YouTube, lift the finger. And this is the unified health goal that is present on the SDGs. However, you can see along the 17 different targets and 17 different goals and 169 different targets, we can also point out which one is related to health. For example, 0 hunger. If you're hungry, are you healthy? No. So you have to reach goal 2 in order to have goal 3. Again, if you have gender inequality, are you going to have good maternal health? I don't think so. I highly doubt it. And this is the interesting part. Why is it planet? The Ebola virus and a lot of other viruses came into this country because of climate change. And Leonardo DiCaprio actually said in the UN, his job as an actor, he pretends that crisis is happening and he pretends to act on those crises. But the political situation right now for the superpowers like UN, like US, Russia, China, they do not pretend that a crisis is happening. They pretend that a crisis is not happening. So this is what we have to address. We are going to deal with significant amount of health changes if we do not care of our environment. This is the universal health care in the SDG target. Look at 3.8. For those of you in the back, this reads, achieve universal health coverage including financial risk protection, insurance, access to quality essential healthcare services, and access to safe, effective, quality, and affordable essential medicines and vaccines for all. Now I'm going to have you listen to this, access and for all. Remember the picture that I showed you earlier? Does this happen?
Yes.
So JKN, how does it work? Obviously you know that it's terrible, but why is it terrible? Look at the red, sorry for the slides. First, at the FASCAS level, out of 80,000 rupiah that you pay as a first class citizen, how many do you think goes to the primary care for the FASCAS?
2,000.
Are you a dentist? Yeah, dentists who can, who have to work with at least 50,000 worth of material, just raw material, not skills, not medicines, is only reimbursed 2,000 for that same amount of money. So you can see there is very little capitation or appreciation that comes to the primary care. Doctors don't have money in the primary care system. They only have 10,000 per patient, even though that patient is sick or not, regardless of how many times that patient comes and how many drugs we spend on that patient. We still only get 10,000. Are we gonna survive? Of course not. Oh no. So what we do is that we refer that patient to the next hospital. Have you ever done that? Yeah. You visit like twice or 3 times and then the FASCAS just got fed up with you and then just refer you to someone else, usually in the secondary type C hospitals. And then in that type C hospital, they will receive referrals. And they do not use capitation system, they use reimbursement system. This reimbursement is case-based. Because a lot of FASCAS actually refer these patients, these hospitals are being overloaded, full of patients who are not supposed to be there. Why are you going to the hospital for a sniffle? That's why, if you have sniffles, they're gonna only pay you for like maybe 15,000 per patient, regardless of visitation. They do not have enough money to deal with this overloading just by 15,000. That's why they increase the diagnosis into pneumonia. Pneumonia will get you like 150,000. And this is why there is a deliberate misuse of the emergency system by the hospitals. Look at the deficit. This is JKN in 2014, nearly 2 trillion. This is in 2015. And this is the projection for the end of 2016. So how can we address this problem? First, of course, address the overuse of claims. Do not go to FASCAS or any other hospital. Do not use your BPJS just because you can. There are other people with TB, people with other sickness that needs those things. So don't go to FASCAS just because you can. Second one is private sector workers' refusal to contribute. Just because you're healthy, don't think that you don't need to register for BPJS. BPJS needs all the money they can get. That's the meaning of insurance. You pay before you get sick. If you pay only because you're sick, then you're cheating. And what I need to pay attention to is that we need to change the focus of JKN from curative into preventive services, because the essence of global health equity is something that is so precious as health might be viewed as a right. Thank you very much.
It's hard in English, so maybe I'll try to speak in bahasa aja. For the MDGs, for the first, yang pertama tentang MDGs, mungkin ini hanya pendapat pribadi ya, karena mungkin kita sudah melakukan MDGs, sudah melewatinya, lalu sekarang ada SDGs. Mungkin secara pribadi saya ingin mungkin agak bertolak belakang ya dengan Dede, tapi bukankah sebaiknya kita menghargai apa yang sudah kita lakukan, walaupun mungkin itu banyak kekurangan sehingga ada goals selanjutnya, karena bagaimanapun ada improvement di situ selama kita melakukan MDGs. Itu yang pertama. Lalu yang kedua, pertanyaan tentang how to overcome the cheating thing on because lots of people just go to use JKN if they're just sick and they don't want to pay after that. Not only because is it about our behavior, just because Indonesian people just not honest enough, or how you going to solve that?
Okay, all right.
Oh, that's smart pen. Smart board.
Oh, okay.
Yeah, I think you can write on that.
It's a smart word. Okay, so that's so transparent. Yeah. So what I'm gonna do is try to walk you through my thought process. You might not be able to follow because I generally just rant or ramble unless I have a concrete object to write on. So the first question is about MDGs and SDGs MDGs achievement so far. If you had seen the video, it's wonderful. Like MDGs has achieved like 91% of secondary education, primary education across all the countries. They have halved the poverty. They have nearly cured. I think there is significant amount of work going on in HIV vaccines. So it's very good. They painted the picture of a golden MDGs, and that's why I didn't bother saying anything good about them. Well, I appreciate it. I only prepared something that is bad because I thought that you're gonna see the goods on the video. But yes, you're right. We have to acknowledge it. Even though this is like a one-sided donor-driven goals, they have done some good, and they have been the biggest catalyst of global movement and partnership. Without the MDGs, we would not have SDGs, and that's very true. And I apologize for being very negative here. The video didn't work. But yeah, if you really want to see how MDGs has still didn't work.
I cannot find the links.
It's supposed to be. I just insert video and then it's supposed to go to YouTube.
Yeah.
Enable. It's a security alert. Let's wait. There. That's why I felt the need to paint that it's not all roses and rainbows. It also have a little bit of a flaw in it. But because that video didn't work, I only look at the flaws, and that's why I look like I'm very ungrateful towards the MDGs. But I am. I really am. The second question is about a very good question. Is it just Indonesian problem, this overuse of claims? At first I thought, yeah. Because Indonesian people are like, oh, I've already paid for that shit. Why can I use it as long as I want to, even though I'm not sick? I need vitamins, right? I can just go to the GP and just get some vitamins, get my money's worth. But that is,
Sorry,
oh yeah.
my question. The question is not the one that can go there, but the one that they pay only when they're sick. And after that or before that,
Oh,
they don't
sorry.
pay anymore.
Yeah.
That's why you don't have the money.
Uh-huh.
That's what I want to.
Yeah.
How you say?
Uh-huh. The government is actually a coercive method to encourage people to pay. You cannot buy a house, I think, if you don't have BPJS, active BPJS, valid BPJS. He's nodding. I assume he knows more than I do.
Yeah, you cannot apply buy a house, you cannot apply SMK, you
Yeah.
cannot marry.
Yeah.
Yeah. Yeah.
Yeah.
I heard about that. I heard about that. But how government can apply that? Because it's against lots of protests, right? Just because you cannot marry if you don't have BPJS. Yeah, but you have to. That's how, what's our nation?
What's our solution? See, that is where I humbly say that I don't know what's the solution together when we actually come back to Indonesia. Because this is not a health problem, and my background is health. This is a political, economical, and developmental sector. I'm not powerful enough or influential enough or knowledgeable enough about these things. I only know that the system that we have is not working. Anybody in the audience can answer that question. How can we implement this thing without generating society rejection? I don't think it's possible, really.
So, it's because this is where we should discuss the critical intersection moment where is it how we as an nation behave in every sector, like for example, just to cross the street. It is like, is it like fundamental? Is it if you put regulation that you have to have BPJS, if you don't, you can't get married, is it going to solve the problem? Or is it more fundamental and it's back to our basic education, for example? This is
Really, look at it from one's perspective. You have to look at it from interchangeable and intersectoral perspective. Spiteful behavior.
Ya, terima kasih untuk pertanyaannya.